Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider. Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I am Hope, and I am your host. Joining me as my co-host today is Victoria. Woohoo!
Woohoo!
Today we're going to be discussing both the physical and mental sides of injury, whether that's prevention, recovery, and everything in between. And today we have joining us Dr. Josh Hansen, a sports medicine provider here, and Brandt Nye, he's a behavioral health specialist here that specializes in sports psychology. Before we get started, I want to give them the opportunity to tell us a little bit about themselves and how they got into their field.
So thanks for having us on. I'm a local kid from around here, grew up playing sports and watching sports and love everything athletic. And so that drove me to pursue this career. I went to the University of Utah for medical school, then came back up to Weber State and did some training with Weber State and McCady, and then spent some time covering some athletics out in Oklahoma with Tulsa and Oral Roberts University. And then came back here this last spring when we opened this clinic and have been with Tanner Clinic since.
Awesome.
Yeah.
This is a field I know nothing about, by the way, so I feel like this is going to be, but I'm excited,
Yeah.
so. Okay, Brandt.
Yeah, so I also grew up here playing local youth sports and just growing up and having a great time. And I went and studied at Weber State for my undergrad and then went on to Minnesota State University for grad school, sports psychology, and also mental health counseling. And I'm just super happy to be back here, being able to provide these services where I'm from, you know.
Yeah, that's awesome. So before we get started, Brandt, you go over for us the phases of injury and recovery?
Yeah, absolutely. So there are 4 phases that we pay attention to, and basically pre-injury, obviously before the injury happens, right? And there are both physical and mental sides to that, where basically the focus is injury prevention. But as injuries are sort of inevitable in any sport, it can be general prevention, but also just sort of trying to decrease the intensity and the severity of the injury as much as possible. So pre-injury, and the next phase is the injury itself, which can involve, again, managing what you do in the moment, how you respond to that right away and immediate, when it happens. The next phase is recovery, rehabilitation, right? That's the whole phase that most people think about when it comes to injury recovery, is the whole, physical therapy, surgery if necessary, whatever it is. And then the last phase is either returning to the sport after the injury and recovery, or transitioning out of sport if that's necessary, if that's what they choose to do.
Awesome. So obviously there's going to be mental and physical aspects of all of these phases. So I'm excited to get into more of the depths of all those different phases today. So we'll have a pretty good conversation, I think. And I will once again learn pretty much everything new. So I'm like, sports?
What are those?
What are those?
And I'm over here with multiple injuries.
And Victoria has some personal things probably to bring up.
I have a lot of personal questions.
We'll find a way to get you back to whatever you want to do. That's our goal of the podcast today.
This is our free healthcare.
Yeah.
So what are some common mistakes that you guys see in the recovery process that can make it more difficult, mentally or physically?
Well, I think most athletes, most people who compete at some level, they're competitive, they're driven, they want to do the activities. And so very rarely do I have to push athletes to try harder to get back. Most of the time, it's really me pulling them back, pulling the reins back, and telling them to slow down and let the whole healing recovery process take place. And so I think 9 times out of 10, it's people are just trying to get back to their sport too quick.
Yeah, they don't want to do this slow. They don't want to go as slow as they probably need to heal, actually.
Exactly. And they see their friends, they see their teammates out competing, they're there kind of cheering for them, and then they want and need to be a part of that as well. And so it really bothers them from, again, a physical standpoint and liking the sport and wanting to compete, but also that mental aspect of not being there with their team and with their friends.
Yeah. What have you seen from like a mental standpoint as far as things that can kind of delay the recovery process?
Yeah, I'd say along with that, a lot of athletes focus on the outcomes, right? The expectations of how quickly they can recover, or maybe how slowly, how long it's going to take. And then they get so caught up in like, I'm going to get better in 2 weeks, when the reality might be 6 weeks or more.
Yeah.
And it can be both positive or negative, right? Even if they think that they will never recover, and that can get in the way too. And most important thing then for that is just, focusing on the process of the actual recovery that can lead to the outcomes that we want, instead of, always focused on like, when am I going to be done with this?
It's true.
Yeah. And I guess depending on like the severity of your injury, it could take way longer than an athlete might expect to get back into it. So I can definitely see if there's like a mental block and they're like, oh, I've been doing this recovery, this physical therapy for like a year. When am I going to get back into my sport? Especially if you're in high school and then you're like missing out on any of that crucial time. So
yeah.
And especially if there are any like unexpected setbacks too, like it doesn't always go to plan, and so if there's any unexpected things that happen, that can be really frustrating.
Yeah, for sure.
I feel like it's that way with basically any goal. When you have that goal in mind and you really want something, like you really want to get back to playing and being with your team or whatever, no matter what it is, if you have any type of setback, it's going to be pretty disappointing, I think, for people. So I think what you said about focusing on just like the steps of, your recovery and doing each step instead of like, when is this going to be done? I feel like that could really, really benefit people in many areas.
Yeah, I think I see a lot of athletes who, we as doctors and physical therapists and the treatment team, we try to give people an idea of, this is how long it's going to take for you to come back, and this is our recovery. And then when it doesn't follow that, then why the heck is this happening? And why is it not doing like we talked about? And every injury is different. Every return protocol is different. And so I can see how athletes get a little discouraged or frustrated, but it's kind of trusting their own process, their own individualized return plan, and just making sure that when we get them back and they can participate fully, they're not at risk of re-injuring or injuring other parts of their body, and they can compete at the level they want to.
Yeah.
Maybe this is personally motivated, but when is it too late to recover from an injury? Like, I know a lot of people out there have childhood injuries or something that they happened in college and now they're in their 40s. Is it too late to recover if they're still experiencing pain from that?
So I would say the short answer to that is no. I mean, honestly, the majority of my patients come in their adulthood, 50s, 60s even, and I say, hey, what happened? How long has your shoulder been bothering you?
And they're
well,
like,
when I was 8 years old, I was on a swing, and tell me this childhood story, and yet still we find a way and we can get them back to doing what they want to do. So for most injuries, we can recover at any time. Now, I would say if you're able to come in when it's a little fresher and the injury is newer and hasn't settled into a chronic issue, then oftentimes that recovery is a little bit quicker, a little bit easier. But really for most injuries, at any point in time, there can be a recovery and get you back.
And so does that mean something like cortisone shots, surgery? Like how do you treat that as a sports medicine provider?
Yeah, so there's a lot of options. First of all, it's doing the diagnostics of it and finding out what the heck is causing the pain, where is it coming from, and coming up with a list of options that we can use to actually help them. I'm a non-surgical sports medicine physician, and so I love cortisone, and I love cortisone shots. And we do a lot of other types of injections and non-invasive, non-surgical procedures that can help with a lot of chronic tendon issues and things. But oftentimes, there can be a surgical need, and someone like me gets you the right diagnostics and figures out what's going on and can get you set up with the right person if there is a surgical. But I would think for most chronic issues, we can find a way to non-invasively get you back and get you doing the activities you want.
Yeah. And then Brandt, is there a mental component to that? Like if I am experiencing pain, how does that play into like day-to-day life, especially if somebody's dealing with a chronic issue?
Yeah, I mean, it could definitely impact, just general well-being. If it keeps you from exercising or being active, then that also influences mental health. Just being active has a huge influence, and not to mention sleep, right? If it's keeping you awake at night, then
literally me last night, because I'm dealing with a flare-up today. I could not fall asleep last night, and then the wind was blowing really hard, and I'm laying there.
Yeah. So there's so many ways, and then socially too. If it's keeping you from going out or participating in sports with your friends,
yeah,
it can just impact so many things.
There is still hope for you, Victoria.
I know.
You're gonna be okay.
Just waiting until
This chronic pain will end.
just waiting till I get better insurance when I get married and use his.
A lot of people obviously play high impact sports, and during their recovery process, they're not going to be able to obviously return back to that high impact sport. I can imagine. Yeah, I can imagine that could be a big struggle for some people who are naturally like very active, and that's like a big part of their life. I was just wondering if you guys ever maybe recommend something else as like part of their like mental health therapy, I guess. Like if they wanted to return back to a sport, is there any like activities or things that you guys would recommend that they, do to kind of get their fill of, playing a sport or,
juices going.
Like a cross training.
Yeah.
So from the medical standpoint, this is kind of my first plug for physical therapy. I'm a huge believer in physical therapy, and you compare kind of studies and how patients recover from any number of injuries, and physical therapy is the thing that helps more than most of other treatment options. And so the thing that physical therapy helps in the recovery process is they can spend several hours a week with the athlete. They can identify strengths and weaknesses and then help tailor the recovery exercise protocol, as well as finding some of the activities and the cross training and things that they can do safely without injuring themselves.
Yeah.
And so I rely heavily on what physical therapists see. And then from kind of my stance as the on the mental side of things is still being around your friends and around the sports and around your team. And if you're on the football team and you've hurt your knee and you can't play, be on the sidelines, be at practice, be with the guys. And that helps significantly with the physical as well as the mental recovery.
Yeah. Would you agree with that, Brandt?
I would wholly agree.
Yeah.
Yeah.
Just participating in some way, with your team. And
yeah,
that makes a lot of sense. And what you said about physical therapy, I feel like, I don't know, physical therapists have such that deep connection with their patient, you know?
Yeah.
Because they're there with them and like exercising the specific muscles, and they know exactly what things they can't do and what they can. So that's a really good point. I know a lot of people avoid physical therapy. I'm sure you know that more than anyone.
I see that a lot, yeah. I do a good sales job of trying to get people to physical therapy.
Yeah. But I've definitely seen the benefits of people I know that have gone to therapy and been consistent with it.
Yeah.
Like I have a family member that has chronic, problems, and they went to physical therapy and they implement that every day, and it helps. So
yeah,
I recommend physical therapy.
I do as well. And I often use my own anecdotal evidence with my patients. I'm a sports medicine physician. I stand on the sidelines. I take care of athletes all the time. But a couple years ago, I had shoulder surgery, and I thought, I know how to do this. I can recover myself. And so I tried doing my own physical therapy. Did not go well. I go spend 2 visits with a physical therapist, and I'm 80% improved after that compared to what I was doing on my own. And so they can spend the time with you. They can get their hands on you. They can see how you move and what you're doing, and they can really expedite the recovery process. But then also, find those ways that you can continue to participate in sport and be active and be healthy while you're recovering.
Yeah. You heard it here, folks.
Yeah, you heard
it from a sports medicine provider. Physical therapy. You need to do it. You can't do it on your own. So just don't even try.
It's always more fun to work out with somebody than by yourself anyway.
Yeah,
so
it's true. They become your little buddy.
Yeah.
They might make you cry sometimes.
They will, yes.
But
when they make you do a minute plank and you're like...
You will trauma bond with them.
So I know a big misconception that people have is once they're cleared from either their athletic trainer, their physical therapist, their doctor, they're ready to get back into their sport. But is that not always the case, right? Like, isn't there still a process to recovery once you start playing again so you don't injure yourself?
Yeah, so I try to be really careful with how I use the word cleared with athletes. Because once you say you're cleared, they will leave my office and go run 100 miles that day.
Yeah.
And so I try to be really cautious. And when I say they're cleared, then generally they're low risk of really re-injuring, and they're good to get back to their sport. But there is, once the physical therapy kind of ends, once the athletic trainer saying things are going good, there still is a return to sport before we can go full bore in the sport. And the physical therapist and the athletic trainer can kind of help us guide that, but there will be some returning to practice, returning to some agility training, doing non-contact activities, and then doing some contact activities in practice. And once we clear those kind of steps, then I feel like we can say you're truly cleared and we get back to sport.
And that means like games or, okay.
Yeah. Yeah. Once we've done that and we've gone through a full practice, then we can get back to sport. Now, after that, I still recommend that all of the athletes take the things that they learned at physical therapy and the things that help them recover, and they need to continue doing those things. If it's ankle injuries, knee injuries, they still could have some of those instability tendencies that led to their initial injury. And so they need to continue exercising those, get them stronger and stronger so that they don't re-injure it again a month later.
Right.
I saw that a lot. When I used to be a receptionist, and we would get a lot of football injuries. So I would see a kid, I would see him with an injury, and then he'd be cleared to play or whatever. And then I'd see him like a couple of months later, and I was like, "You back?" Yeah. I was like, at that point, I was like, "Just don't play football." It gave me some bad vibes with football because all these like boys were getting injured. I was like, "You should not have gone back."
Yep. And I'd say some of it's getting back too soon. Some of it is just they have body mechanics that need to be addressed, and in doing those exercises, maintaining the strength and the flexibility that they learned through therapy, those are the things that are going to help them be more successful.
Yeah.
Yeah.
I feel like another misconception with athletes is if they're really struggling or like having a hard time during the rehab process, that they're not tough. And I feel like a lot of athletes really pride themselves in being tough and strong. And so I think that they can really struggle with that. So what do you do with someone that's struggling with feeling not so tough as an athlete?
Yeah. Such an important question, important topic. I think, there's definitely a narrative shift that can happen just around the perception of what it means to be tough, and I think I can compare it, to fear and courage, like courage can't exist or happen without fear, nobody can be courageous if they're not afraid of something, So I see it the same way, you can't be resilient if you don't have any challenges or struggle, right? If you're not struggling, resilience isn't a thing.
Yeah.
And everybody's got their own challenges and their own struggles, but being able to say like, this is hard, now I can be resilient, that's the opportunity to be resilient.
Yeah. And I feel like there's a lot of outside pressures just thinking back of like, I just remember when Simone Biles was like really struggling and everyone was like, oh my gosh, what a baby. Like, I was like, she's an Olympic athlete and you're sitting on your couch. The guy that's like with his chest, he's like weak. So I don't know. I feel like they can get those outside pressures. Is there anything that you recommend with like, if they're hearing something from maybe like a coach or someone or like a family member, maybe somebody's giving them some outside pressure. What would you suggest that they do with that?
Don't listen. No, it really comes down to like, what's important for me? What do I need? And is this actually helping? Is it helpful to think about how hard this is, right? Is it helpful to expect myself to not have any struggles or expect myself to, just be able to do everything first try and be okay,
Yeah.
So on a similar note, there's also that side of pushing through the pain. And at what point is that something that's good for the athlete, or is it actually more detrimental if they're experiencing physical pain?
I think there's a time and place for both sides of that. And I think that's a big part of the reason why it's important for athletes to be seen and be properly diagnosed so we know what's going on. When I see an athlete, I always put them into kind of two categories. Either there's pain and inflammation, something's going on that's causing them issues, or there's a true injury. Now, if there's a real injury, then we can't just push through the pain. We're going to hurt ourselves more. We're going to have more problems long term. But there are a lot of things that are just pain. And as long as we properly diagnose, we know what's going on, we have a recovery plan, we can help them kind of push through the pain and get better from whatever's causing that pain. And so I think there's a side of both for both of those.
Mm-hmm. And so is that like muscle pain, obviously, if they're working out a lot and they think, oh, this could be from my injury. How do you know the difference between like injury pain and pain from like practice or something?
Yeah. So there's a lot of opportunity to get that from just physical exams. And, I can examine somebody's knee and pretty quickly identify, is an ACL torn, is an MCL torn, is there something torn or broken, or is there something that's just irritated? And so oftentimes physical exams are good enough to do that. Sometimes we use imaging like x-rays or ultrasound or MRIs to be really sure and know exactly what's going on. But again, oftentimes it's just getting your hands on the athlete, seeing how strong they are, seeing how the joints and ligaments move, and get a good diagnosis from that.
So going back to the mental side of that, how do you help an athlete that is maybe afraid of re-injury? I know that can cause some mental blocks for them. So how do you navigate that fear of re-injury with them?
The words that come to mind are threat appraisal, right? And that is just how the individual perceives, like, how threatening is this to me, right? Mm-hmm. And that involves identity, right? How much of me is what I do in this sport? And if that's taken away, how big of a deal is that for me, right? And that's contextual too, right? How does this affect my playing time? How does this affect the rest of the season, right? Are we in the playoffs right now?
Yeah.
Or will I be able to get back for playoffs, right? There's so many things that determine, how intense or how severe, how threatening this is for that individual. And so we can address it that way and say, how can we minimize how threatening this is, basically, to an identity, to this individual. And when it's perceived as less threatening, then we're free to just go play, as if we're not afraid of injury. Everybody's afraid of getting hurt. That's normal and natural. But when it becomes this thing that's anxiety producing and like, oh no, whenever I do anything, it's just gonna lead to more pain.
Yeah.
That's when it becomes a hindrance, right? And it gets really hard to play freely.
Yeah.
And then does it become more dangerous too? Like if you're playing with fear, maybe you're moving not as as agile as you should be. Yeah,
you're definitely more likely to play like on your back foot, right? Or more hesitant. And then that can actually, it can definitely lead to greater likelihood of injury or even intensify any potential injuries.
I don't know why I just keep going back to gymnasts because like I feel like when you're like about to do this like floor, like
right,
all these flips and stuff, like imagine being just afraid to be
nervous.
Yeah. You really have to be confident in order to do that.
Really trust your body and trust your training. And if you have one of those mental blocks, it can be hard to go without fear. So
yeah. Oh, and that's actually an important point because again, like nobody goes without fear, and the fear gives the opportunity to then say like, what am I going to do with it? Because I think, and if we're focused on not feeling the fear, that's going to cause more problems when we do feel afraid, because and it's totally normal is to feel afraid. And so it can be harder to perform freely if I'm saying, I don't want to feel this. I don't want to feel anxious about this. I don't want to feel nervous. But I am.
And so do you have like certain therapies that help your patients with that? Or is there like a technique to help them through it?
Yeah. I generally lean, you talk to different people and they'll have different viewpoints, different approaches. I lean towards called acceptance commitment therapy. And it's exactly how it sounds, right? Accepting just the human experience with all the emotions, all the thoughts as they are. And as soon as we can let go of needing to control that, it frees us up to then decide what we want to do with it, right? And so we can perform freely. We can be with all of these things. We don't have to push them away.
Yeah.
I was going to say there's like a healthy amount of fear because you were talking about that and I'm like, imagine like having no fear.
Like you just jump off a cliff.
I mean, I'm sure there's people like that though. And like, but I feel like having a little bit of fear is probably good.
Yeah.
So what sort of benchmarks should athletes expect to see when they're getting ready to return to play?
So most injuries have a pretty similar recovery protocol. Sometimes that's days or weeks, sometimes that's months and months. But generally speaking, we have a rest and protection phase. Then we get to kind of a range of motion and basic strengthening phase. And then we start getting into true physical therapy where we're working to regain our agility and our strength and our balance and our control of that injured body part. And so before we can get back to running on a field and playing football, soccer, or whatever it is, we need to be able to do those same types of maneuvers in a more controlled environment in physical therapy, in practice without other people bumping and running into you. And so really the protocol to get us back is do the things on your own, get your agility and strength back kind of on your own as an individual, and then with others around you in practice, and then going full contact and playing after that.
Yeah, and obviously it's going to be different for
every
each
injury
athlete,
is different and every athlete.
Injury is different. So Do you work with the athlete from the beginning? Like if they come and see you and then they go to physical therapy, like are you working with them long term for that?
Yeah, so I like to see all my athletes come back after physical therapy, and once physical therapy has given them kind of the green light and the thumbs up to go back to their sport, I want to see them talk to them about how things are going and come up with the last few plans to prevent re-injury.
So, Brandt, is there anything that you do in your therapy that can help athletes with mental resilience?
Yeah, I think definitely, and it's an individualized process too, right? So it depends on the person, but generally it comes around to how can I be okay with where I'm at?
Yeah.
Because a lot of times that's the hardest part is we'd rather be somewhere else, or we'd rather feel differently about this, and that makes it really hard to make any changes.
Yeah.
So first step is always just that acceptance piece again of this is where I'm at right now. What do I want to do with it? And then we can work on next steps of, if it's confidence, if it's motivation, if it's, again, fear of re-injury, whatever it is, we can start there only after we get that first, the initial acceptance of like, yeah, this sucks. This is hard. Now let's start. In terms of, the recovery process that's often challenging, kind of like where I was saying before, focusing on the process of it and less on the outcome of what do I expect to happen and when do I expect it to happen. If we can stick to, set up the conditions for success to happen, and then you can let the outcomes come as they will.
And I definitely think that's the benefit of seeing, a therapist for sports psychology is you're experiencing these mental setbacks, but you don't really know what's causing them, or you're not sure how to overcome that. And that's like what's missing in your, on your edge or whatever. You just need that little bit more mental edge. Doing sports psychology can help you address that concern, right? And be able to overcome that, something that you wouldn't be able to overcome by yourself.
And it's not
hard
always
to know.
just for injury. It could be if you're just like having a mental block like Simone Biles did. She probably went and saw a therapist. I don't know. I'm assuming. Simone, I'm sorry.
I'm sure Olympians probably have a therapist. They probably give
about it
Yeah.
in the public, so we can say that.
So it definitely helps you, and there's no shame in seeing somebody for that. At least I think. And I'm right.
Yeah. So listen to Victoria.
Mark it.
She's the expert here.
Clearly.
And that's why we have her on here today. She's actually our third guest.
We appreciate it.
She's not the co-host. She's actually the third guest. She secretly has... Just kidding.
All in the lore.
It's the lore.
So for athletes that might be transitioning out of their sport, whether it's for a really bad injury that they just can't recover from quick enough in time, if they're aging out, if they maybe get cut from a team, how do you help them go through that process of that major identity shift?
Yeah, and it really is a huge identity shift because, especially in youth sports, and then just the culture around here, and then high school sports, these kids grow up and that's what they do. That's their thing, and then that becomes, you ask a high schooler, oh, who are you? And they say, I'm a basketball player.
Yeah.
and then that's threatening when that gets taken away, if they get cut from the team or if they're injured, and then, who am I? What do I do? And so, yeah, we can definitely address that and walk through that. It's kind of an individual basis, right? It's different for each person. But generally having a well-rounded personality or a well-rounded identity.
Like sense of self.
Yeah, sense of self can be healthy, right? Really healthy, and that promotes resilience. If I, one part of myself can get taken away, what else can I lean on? What else is there to me? Whether that's family or school or, activities, whatever else this is me, and I play my sport, I can't remember what professional golfer it was, but there was a professional golfer who spoke about that. He said, I am more than what I do. He's like, I am not a golfer. I'm a person who loves to golf, and I get shared for it. But like, that's such an important perspective on it.
And I think that plays into not just sports, but as you get older and you're a professional, like, we're not just marketing. We have more stuff to us than just our job. And I think a lot of people can lose sight of that sometimes when they get so pulled into something and it becomes such a major part of themselves. Like I said, I don't know if I mentioned it earlier, but I swam a lot growing up. And then I coached, and then I was on a college intercollegiate team. So when I stopped college, when I graduated, it felt like, oh, well, that was my last swim meet. What do I do now? But then I remembered there's so much more to me than just what sport I played growing up.
Yeah. And if you can develop that before the sport ends, even better.
Yeah, I did. Because I was lucky. My parents had me involved in a lot of different stuff. I was really heavily involved in scouts and other things. So having other parts to myself that I felt connected to played a big part in moving on from that time of my life. And I still swim to this day. And I think you can still do your sport after. There's like adult leagues. There's...
Yeah, just because you're not on a team or whatever doesn't mean you can't do it for
Or you
fun.
can pick up something new, like pickleball.
Yes.
Yeah.
Pickleball.
So I think it's time that we kind of wrap up this episode, but I wanted to give you guys an opportunity to leave some words of advice. So what is something that you would tell an athlete that is in the process of recovery?
You have to trust the process. As long as you've had a good diagnosis and the treatment team has kind of come up with a good plan for you to recover, then you just have to stick with it. And you have to trust that will get you back to what you want to be and what you were before the injury, and work towards that.
Yeah. They're not just trying to torture you.
Exactly. Well, they do a little bit. They
do, but that's not the point of what they're doing.
Exactly. There's the end goal of making you happy and healthy and doing your sport again or your activity, but it may hurt a little bit.
It may feel like torture for a minute, but yeah. What about you, Brandt?
In addition to trusting the process, just reach out for support.
Yeah.
Nobody does it alone. Well, nobody does it well alone.
You can't do it alone, for sure.
Yeah. But there's always people out there wanting to help.
Well, I just want to thank you guys for coming on here today. And
Thank you.
I always say taking time out of your day because I know that you have patients to see and you're busy, but we always appreciate the advice and the knowledge that we get. I always say it's like receiving free healthcare, because I learned so much in every single episode. And although I'm not I don't really identify myself as an athlete, I feel like aspects of this conversation can be applied to anyone who is passionate about anything and working towards specific goals. So I appreciate you guys coming on here. I want to close out by just recommending that you follow along with our journey. Follow us on our social media. Tanner Clinic is this normal doc. You can find us on our social media, and if you follow along, you can ask questions for future episodes.
It's always good to get some personal questions answered about 10-year-old injuries that it's not too late to recover from. So.
It's true. It's not too late.
Never too late. Never too late.
And we will see you next time on Is This Normal, Doc?